When we seek treatment for any illness, we deal primarily with doctors and nurses, but we forget that in between, there are a number of other individuals who have played a part in fixing our problem. On this episode of Health Matters, we want to shine the spotlight on allied health, the health professionals who aren't always recognized for their role in our healing process. Many of us have at some time overcome a health challenge or health scare. And when we're all better, we're full of gratitude and praise for the doctors and nurses who got us there. But how many of us are actually aware of the behind-the-scenes players? They are the host of health professionals who draw and test your blood, for example, do your x-rays, MRIs, or ultrasounds, provide you with nutritional advice or physical therapy, and dispense your medication. You may not see them, but they are integral to your diagnosis, treatment, and recovery.
When you refer to allied health professions, you're talking about mainly outside of doctors and nurses. So you're looking at your occupational therapist, physiotherapist, psychologist, counseling psychotherapist. Let's say you have a diabetic. One of the issues that people with diabetes has is foot ulcers. And foot ulcers can then lead to amputations. So one of your key allied health professions would be a podiatrist, and they specialize in looking at feet. So every year, a person with diabetes should go to a podiatrist to have a look at their feet and make sure that, do they have any foot ulcers? Make sure that their feet are well taken care of.
As we hear, these allied health professionals are obviously integral to patient care. So why are they classified differently? Why the distinction?
Some of them, like your physios, after you've been in an accident or had any trauma or any surgery, they will help rehabilitate you to get you functioning back in life. Same with an occupational therapist and speech therapist. They will help you come back with, your hand movements, your fine movements, even your speech, and even your hearing.
We find allied health professionals in most sectors of healthcare. They either provide direct services to patients or support other healthcare providers.
A lot of times you find them either in rehab hospitals, where people are undergoing rehab, in private practices, and they usually also work in what we would call your multidisciplinary teams. And they come together in a team where they look at discussing you as a patient and also improving your patient outcomes.
The list of health professionals who play very crucial roles in improving the lives of patients outside of doctors and nurses is so long and varied that we have to wonder how we would possibly cope without them.
There is no system without them. They are integral in that system. They form part of that system. As a doctor, I can diagnose you, I can treat you, but I'm going to need to hand you off to someone else who can get you back to your daily activities. It might not be normality, but get you back to your optimal level of activities.
Do we have nearly enough of them to keep the wheels turning?
In general, there's a shortage, ironically, of health professionals, but it really happens in your rural areas. And that greatly impacts the health outcomes. Traveling long distances just to get basic health care or see your allied health professions who would be able to prevent certain complications from the diseases. And you'll find that by the time people in our rural areas do seek health care, it is too late.
We will always need and value doctors and nurses. They are the people on the front lines of our healthcare wars, as we've seen with COVID. So don't you think it's time we recognize this whole other layer of healthcare professionals we hardly give a second thought to? And given the high youth unemployment rate in this country at the moment, we should be doing more to make these careers attractive to our young South Africans.